friends as a result of this COVID-19. And now I think the mother is doing it as
For speakers, can we try our microphones? I will start with some. Can we hear your voice?
Hi. Hello.
1, 2, 3, 4.
1, 2, 3, 4. Am I okay? Hi, Jennifer.
Just a minute, Sam. Just a minute.
Okay, thank you.
Around 1.2 billion girls.
Okay, Dr. John, please can I hear your voice?
Are directly impacted by COVID-19. Partly because of the agenda, age, and other vulnerabilities.
Can you hear me?
Poverty,
Hi,
everybody.
Hi, okay.
Race,
Can you hear me well?
And
Yes, we can hear you.
practices.
Okay.
most of these
Okay,
children are
Sarah, you're
complaining
the
about
moderator.
domestic violence, and parents are
Hello.
sucking
Hi,
their
Jenny.
girl children
Hi.
from the home to
Okay, thank you.
go to their boyfriends as a result of this
So someone else
COVID-19.
was supposed to be
Hello,
here.
Hello.
Yeah.
Good morning.
Good
Good
morning.
morning.
Commissioner Amira.
Commissioner, I would request you,
Commissioner Amira.
are you able, Madam Commissioner, I would request you, can we move your camera a bit because it's a little bit far from your face?
Far or near?
Yeah.
How is it? Tell me. When it's okay, tell me. Is it okay now? Is it okay or not yet?
Yes. Yes, it's fine. It's better.
Is it okay now?
Yeah, it's better. It's better. Thank you. Okay. We don't have Hannah is not in yet, and Dr. Shimeris is not in yet. So,
Ambassador Catherine, how are you?
I am
Ambassador.
very well, thank you, Commissioner, my dear sister. Good to see you.
Good to see you too. How is Corona doing with you?
I hope you continue to stay strong, you strong woman of Africa. You're doing a tremendous job under such difficult circumstances.
Around 1.2 billion girls,
Thank you for your
of whom
support.
600
Okay,
million are adolescents, are directly
Sarah,
impacted
please check for
by
me French and
COVID-19.
Arabic.
Partly because of the agenda, age, and other vulnerabilities, including poverty, disability, race,
Okay,
ethnicity, and
Straton
resistant
and
discriminatory
Jafar,
practices.
check
Most
if
of
they're
these
working.
children are complaining about domestic violence, and parents are sucking their girl
Yes,
children
it's
from the
French
home
is
to
working.
go to their boyfriends as a result of this
Let me check the Arabic.
COVID-19. And now I think the mother is doing it as
It's also working.
Okay, fine.
Thank you.
Okay.
All right.
So we start in 1 minute. Or can we wait for Hannah? Hannah is not in yet. Hannah is not in.
Yes.
Do you want me to check them?
Yes, please.
Okay. I think in the interest of time, we should start and then Sam will check on Hannah. Hello,
Around
everyone.
1.2 billion girls, of whom 600 million are adolescents, are directly impacted by COVID-19. Partly because of the agenda, age, and other vulnerabilities, including poverty, disability,
race,
Around
ethnicity,
1.2
and
billion
existent
girls,
discriminatory practices.
Most of these children are complaining about domestic violence, and parents are sucking their girl children from the home to go to their boyfriends as a result of this COVID-19. And now I think the mother is doing it as a
race, ethnicity, and existent discriminatory practices.
Most of these children are complaining about domestic violence, and parents are sucking their girl children from the home to go to their boyfriends as a result of this COVID-19. And now I think the mother
Go, Sarah.
Yes.
Sarah?
Thank you very much. Hello, everyone. Good morning. Good afternoon. Thank you very much for every one of you for joining us during this exciting launch of the report titled Under Siege, the Impact of COVID-19 on Girls in Africa on the very day of World Humanitarian Day. A very warm welcome to you all. I am Sarah Tabit. I'm the Girls Advocacy Alliance Project Manager, Africa Region, working for Plan International, the African Union Liaison Office. I will be your moderator for this launch. We have French and Arabic translation, so you can actually go down and choose from that. The Arabic translation shows as Japanese. Sorry about that, but that's
الترجمة باللغة هي تكون باللغة.
I'm also very honored to recognize the presence of Her Excellency Commissioner Amira El-Fadel, who is the Commissioner for Social Affairs, African Union Commission. Thank you very much for making the time from your extremely busy and demanding schedule to be with us, Commissioner. I'm also very humbled to recognize the presence of Her Excellency Ambassador Catherine Mwangi, Kenya's Ambassador Extraordinary and Plenipotentiary to Ethiopia, Djibouti, the AU, IGAD, and UNECA. Thank you so much for honoring us with your presence, Your Excellency. I'd also like to recognize that there are more than 300 distinguished participants registered, and we have
أكثر من 200
joining us right now from different places, including the African Union member states, development partners, UN agencies, African Union Commission, the European Union Commission, African civil society organizations, higher learning institutions from around the world, international NGOs, youth, and the media. Thank you so very much for joining us this afternoon. This report is actually a result of a very fruitful collaboration between Plan International and the African Child Policy Forum, who recognized the gap in evidence in understanding the impact of COVID-19 on girls in Africa. This report was also financially supported by the Ministry of Foreign Affairs of the Kingdom of the Netherlands. Let me give you a brief rundown of our program so that you will be able to follow us through. First, we'd have the opening remarks by Her Excellency Commissioner Amira El-Fadel, followed by a keynote speech by Her Excellency Ambassador Catherine Mwangi. Right after that, we will have a very vibrant dialogue among a youth ambassador from Ghana, Hannah Agimang, and the Executive Director of African Child Policy Forum, Dr. Joan Nyanyuki, Director of Plan International African Union Liaison Office, Mr. Samuel Norga, and representative of the Embassy of the Netherlands in Ethiopia, Lydia Atomsa, who's also a Senior Policy Officer for Gender and SRHR. Then that dialogue will be followed by plenary discussion where all of our distinguished participants will have the opportunity to forward their questions and also reflect on some aspects. And then the panelists will also have an opportunity to briefly reflect on the questions and reflections. And then we'll end finally with Her Excellency Commissioner Amira Al-Fadel launching the report. Now, without further ado, let me invite Her Excellency Commissioner Amira Al-Fadel, the Commissioner for Social Affairs for African Union Commission, to officially open this event. Madam Commissioner, you respectfully have 7 minutes. Thank you.
Thank you very much, and thank you for your moderation. And let me start by welcoming all the participants and greet them on behalf of the Social Affairs Department. And I will start by my sister, Catherine, Ambassador Catherine, Ambassador of Kenya. Always good to see you, Ambassador. Also the Executive Director of the African Child Policy Forum, Dr. Juan. Good to see you, Juan. Director of Plan International AU Liaison Office, Mr. Samuel. Good to see you also, Samuel. And all the representatives of the member states and the UN agencies, my young daughter here, Hannah, all of you, I welcome you to this very important meeting at this time of the coronavirus pandemic. And before going into my written statement, let me just take a minute or two to say that we as African Union, we decided since the beginning of this pandemic and 1 week after the first case being reported in the continent, we decided that Africa will act together in solidarity. A decision is being made by our member states. A joint continental strategy and on anti-COVID-19 is being approved by an emergency meeting of the Ministers of Health. And there is one vision for Africa in implementing this policy. Also, there is a solidarity between member states. They all decided that they will act in solidarity. They provided resources because one of the challenges we have with this COVID-19 is that we need a lot of financial resources. So the anti-COVID-19 fund is being established by the African Union. There is a board of trustees. So we have decided on the policy. We have decided on the resource mobilization issues. We have decided as Africa on the mechanism, which is Africa Center for Disease Control and Prevention. The specialized technical agency of the African Union is Africa CDC, who is leading on the implementation on the technical level for this policy. So these just a few remarks I wanted to start with before going into my written statement for this meeting. Excellencies, ladies and gentlemen, I would like also to start by the great work done in child and Plan International challenges our girls are facing due to the COVID-19 pandemic. The substantive information contained in the report is precisely well articulated and assists child rights actors on what interventions should be undertaken to assist girls in protecting and cushioning them from the various violence and abuses they are being subjected to. And we all know that, unfortunately, because of the measures taken for COVID-19, girls are suffering more from gender-based violence. Distinguished ladies and gentlemen, COVID-19 is affecting girls in two folds. First, girls are disproportionately affected by the pandemic itself. They do not have sufficient access to information on prevention and treatment measures, and they undertake the usual household work without taking the necessary care. Second, the home stay measures undertaken to mitigate the transmission of COVID-19 has increased a lot of burden on girls and has exposed them to violence and abuse. As most family members are staying home, they are burdened with many classes during this time. Moreover, girls are becoming victims of sexual abuse, exploitation more than due to homestay measures as well as unemployment of their guardians. That means people are losing their incomes. There is economic hardships on the level of the families. So sometimes families, they think of child marriage as a solution. So they put young girls to marriage to spare a mouth to feed and also to have more financial resources. Excellencies, ladies and gentlemen, I am delighted that this report is released at the pertinent time where COVID-19 is escalating in the continent. Unfortunately, COVID-19 is far from over, and we're expecting a second wave. The numbers are increasing. It is more than 1 million affected cases. It's more than 25,000 death toll in Africa. Yes, the recovery rates are high, but still the risk is far from over. The report unveils the multidimensional nature of the impact of COVID-19 on girls, as well as factors that contribute to the increased abuse they are facing. The report underlines that stay-at-home measures accompanied by overcrowded households in the continent and economic dependency makes girls more vulnerable to abuse and exploitation in situations of pandemic such as COVID-19. Moreover, lack of protective health services exacerbate the long impact of sexual abuse that girls are facing. I wish to inform that my department in the children stated in the recommendation section of the report, the African expert on the welfare of the child has developed a guideline or a guiding notes to member states on measures that should be taken to mitigate that. We, as 8 departments of the African Union Commission, we have developed one comprehensive document on the socio-economic impact of COVID-19. And this document is going to be implemented by the 8 departments, plus the partners, because we have shared it with 11 partners, including the UN agencies, and it includes everything. It's really a comprehensive document, and I'll make sure that it will be shared with all of you. Excellencies, ladies and gentlemen, further to this, the Department of Social Affairs, within the framework of the Harmful Practices Project, has been addressing the impact of COVID-19 on girls being subjected to increased child marriages and female genital mutilation. The department, in collaboration with the Gender Directorate, is currently conducting a similar key research at this report. There is an ongoing research jointly between my department and the Department of Gender. The research will explore the short, the medium, and long-term measures that need to be taken by member states and RECs and the African Union and its organs, in particular to strengthen national interventions to protect children and women against gender-based violence during these extraordinary times. Once the report is finalized in September 2020, as scheduled, the Department of Social Affairs will work with stakeholders to provide training to member states' focal persons working on child protection issues for them to understand and incorporate the guidelines in the aforementioned research. I would like to conclude by saying the report is not and should not remain as a piece of information. Rather, it should be used by all stakeholders to inform on COVID-19 to protect girls from the negative impact of the pandemic and measures taken to fight the pandemic. I assure you that the African Union Commission, particularly my department, Social Affairs, will utilize the report in its activities as well as its call to member states. And I commit myself and my department that we will work jointly with all of you to make sure that the recommendations of the report, it will be fully implemented and a more protective environment will be created for our girls in Africa. Thank you very much for listening. Shukran jazeelan. Thank you.
Thank you so much for that moving opening remarks, Your Excellency. I wouldn't even attempt to summarize those wonderful words, as well as the different aspects of work that has been laid by you and the African Union. I would really also like to really appreciate you for clearly articulating the plight of girls under the COVID-19 and to really show us, the strategies and also, the one vision and solidarity by member states to address the impact of COVID-19 on the lives of girls in Africa. Thank you very much. Now, it's my most honor to actually invite Her Excellency Ambassador Kachi Mwangi to give us her keynote remarks. Your Excellency, thank you so much again for being with us and honoring us. You respectfully have 10 minutes.
Thank you very much. Thank you, Moderator Sarah, for your warm and kind words. And let me start by apologizing to yourself and to the rest of the participants for what appeared to have been a little unprofessional engagement of my part. I'm having many issues with my internet, so I keep moving from the computer to the phone. So please forgive me, but I'm hoping that now I'll be on until we finish our meeting. Your Excellency, Amira El Fadil, Commissioner for Social Affairs of the African Union Commission, my dear sister, let me say that as people of Africa, we're extremely proud of you, proud of the work that you're doing for the continent insofar as managing this pandemic is concerned. You and the entire CDC indeed have done this continent proud, and we continue to wish you well and to stand with you as you really lead the continent in dealing with this crisis. So we wish you well, and we are proud of you, and we will continue to pray for you that God would give you strength. Ms. Hannah Agiman, the youth leader and Plan International Ghana Youth Ambassador, Dr. Joanne Nyanyuki, Executive Director, African Child Policy Forum, Mr. Samuel Noga, Director, Plan International, African Union Liaison Office, all the girls who have managed to log in and are participating in this session, ladies and gentlemen. I wish to warmly welcome you all to the launch of this very important report titled Under Siege, Impact of COVID-19 on Girls in Africa. The COVID-19 pandemic has posed an unprecedented global and regional challenge at unimaginable scales. It risks undoing decades of progress for girls' rights and gender equality. There is enough evidence to suggest that pandemics have different and varying impact on women and men, as well as girls and boys, and thereby exacerbating existing inequalities where women and girls have been affected negatively and at a disproportionate higher rate. COVID-19 is no exception. According to the Africa CDC, over 1 million people have been affected to date by the COVID-19 pandemic since its onset. And this has disrupted the livelihoods of millions of people in Africa. The pandemic poses a serious risk of potential reversal of the limited strides achieved over the past decades towards gender equality in Africa, as the pandemic exacerbates existing inequalities in social protection, health, as well as socioeconomic and political spheres. Pandemics, like other crises, often result in the breakdown of social infrastructure and services, leading to health, transport, food, sanitation, legal, security, and other governance structures being temporarily contracted or becoming completely dysfunctional. Such situations have the tendency to increase exposure of women and children to human rights abuses, including exposure to gender-based violence. Earlier discussion on the impact of COVID-19 on children and girls have drawn experiences from previous pandemics, such as Ebola, and the use of other anecdotal evidences on the possible impact of COVID-19 on children. We didn't have a comprehensive study documenting the impact of COVID-19 on girls in Africa, which makes evidence-based planning, policymaking, and implementation all the more difficult. It therefore gives me great pleasure to see this report, which bridges a notable gap in evidence and data. It is also highly commendable to see that the voices, realities, and recommendations of African girls have been captured in this report. This report will therefore inform continental advocacy and drive a continental discourse on our COVID-19 response and how we can take progressive steps to address girls' issues. The pandemic, of course, is also disrupting the already strained basic healthcare services for Africa. For example, measles immunization campaigns have been suspended in at least 27 countries, and polio campaigns disrupted in 38 countries, cumulatively affecting at least 80 million children under 1 year old. And since the onset of COVID-19, in addition, shutdowns associated with this pandemic have disrupted early learning, formal education, and livelihoods, where more than 91% of the world's students have had their education disrupted, while almost all member states in Africa have their formal education curtailed. Inequitable access and the digital divide between the urban and rural communities prevent a lot of girls from accessing online learning. In Africa, where the livelihoods of girls and women mainly depend on the informal economy, the lives of girls, their families, and communities face extreme stress from economic and health burdens. The ILO estimates that African informal workers will face a staggering 81% decline in earnings, which is the largest globally. Up to 29 million Africans are expected to be pushed below the extreme poverty line of $1.90 per day, owing to the impact of this pandemic. There are also reports of exacerbated domestic violence, which is described as the shadow pandemic. Child marriage and other harmful processes following the breakdown of schools and other formal structures are adding to this problem. When girls are out of school, they struggle to access social support structures and essential services such as sexual and reproductive health services. The report we are launching today covers and exposes several staggering spikes in domestic violence, rape, transactional sex, child marriage, and other harmful practices around the continent. The COVID-19 pandemic is likely to cause over 1/3 reduction in progress towards ending gender-based violence by the year 2030. As we go through the report, we will hear very clearly the impact of COVID-19 from the perspective of girls who have narrated how their lives have changed and how they expect their leaders to respond to the crisis without leaving anyone behind. Despite the challenges articulated by the girls, the report also identifies efforts being put in place by the African Union, by our member states, UN agencies, donors, and civil society organizations to effectively collaborate to provide respite and to reduce the impact of COVID-19 on children and women. Notwithstanding these efforts, however, there are concerns that the needs of children, adolescent girls, and women far outweigh the resources being invested by governments, development agencies, and donors. Let me, as I conclude, put forward a few recommendations for consideration and for discussion by this meeting. We would like to call for action by member states of this continent. One, that they would reinforce multi-sectoral child protection systems for girls who are at risk of experiencing abuse, violence, and exploitation, including by ensuring access to justice for survivors. And multi-sectoral ministerial coordination needs to understand and commit to address the gendered impact of COVID-19 on the African girl. We need to recognize girls' voices and agency by consulting and taking into account girls' and young women's views in the response and recovery to COVID-19. We need to engage communities, including local leaders, family, and caregivers, particularly girls and women, CSOs, and international development partners in all stages of the overall response. There needs to be a rapid scale-up of economic safety nets and poverty alleviation programs, such as cash transfers, paid leave, and free or subsidized health services with proper gender-responsive orientations that prioritize women and girls heading households, and as well as girls working on the streets. This is a reality. My call for action to CSOs, the international community, and other non-state actors is to support the government's response plan and actions through authentic engagement of girls and young women, funding and engaging in reaching the most disadvantaged. Excellencies, distinguished participants, girls, ladies and gentlemen, let me conclude by emphasizing that Africa's success in tackling the pandemic and mitigating its impact on children now will have serious implications for its future continuity and well-being as a continent. The question we must ask ourselves is, are we ready to do our best in order to turn this misfortune into an opportunity? I'd like to finish by reiterating and quoting one of our founding fathers, Mzee Jomo Kenyatta, founding father of the Kenyan nation, in one of his famous quotes where he says, and I quote, "Our children may learn about the heroes of the past. Our task is to make ourselves the architects of the future," end of quote. I'd like to congratulate PAN International and the African Child Policy Forum for articulating girls' voices on the impact of COVID-19 on their own lives, and encourage all of us to take seriously the recommendations put forward by the girls in this report. I thank you, and I wish us a successful launch. I thank you.
Thank you so much, Ambassador. I certainly wish to express my sincere gratitude to you, Your Excellency, for being with us, but also, for gracing our launch event with your presence, but also challenging each and every one of us if we're doing enough. As you emphasized, Africa's success in tackling the pandemic and mitigating its impact on children now will have serious implications for its future continuity and well-being as a continent. Thank you so very much, Ambassador. We're now moving on to the very anticipated dialogue among our distinguished panelists. And it's certainly a great pleasure for me to invite Ms. Hannah Ageimak, who's a youth leader, a vibrant girl, a gender advocate, and Plan International Ghana's youth ambassador. Hannah is 20 years old and a senior high school graduate. She has been actively engaged in, and working with young people, especially girls and children in rural and deprived communities in Ghana, on issues including teenage pregnancy, menstrual hygiene management, gender equality, and child rights. So it's absolutely wonderful to have you with us, Hannah, today. Hannah, so my question for you is, as a young woman and a leader in your community, if you could give us your thoughts on the impact of COVID-19 on girls and, young women like yourselves and, the people that you engage with. And if you could also provide us with few key recommendations that would enable girls and young women to build resilience in the face of the COVID pandemic. Thank you so much, Hannah.
Okay, thank you so much. My name is Hannah Juman. I'm 20 years of age, and I'm a youth leader for Plan International Ghana. And most importantly, I'm very excited to be here this morning. Yes, as part of the challenges COVID-19 has posed to girls, especially in Africa. Over the years, we've experienced this severally, but COVID-19 has come to deepen the cases we report daily. And one thing I want to talk about is the increment in domestic violence in our homes. Children are being abused in homes, especially in Africa, the girl child as well. Recently, it was in the news, a 4-year-old girl has been raped by an 18-year-old boy. Now, this is as a result of school closures. Because of the closure of schools, these children are at home, they are lazing about, they are doing nothing, and there's no effective supervision by parents. So they are just there lazing about, and they are exposed to all sorts of environmental harsh conditions. Another thing also is the increment in teenage pregnancy. The closure of schools has really done a lot of harm to us as a result of COVID-19 because we are at home. Personally, I am at home. It's not every young girl who would have the parent to tell her, do something for your life. These young girls are at home and they are getting themselves pregnant. And some are exchanging sex for food, for sanitary towels, and any other basic need. And it is so heartbreaking. I'm talking about the closure of school because if I am at school, at least the government will provide me food. In Ghana here, the government provides us with food, the government provides us with shelter, and teachers are there to secure us. Now, all these are laid off, and so I'm exposed to all manner of harsh weather conditions and harsh environmental conditions. And then the other thing I also want to talk about is the, can you hear me?
Yes, we can hear you, Hannah. Go ahead.
Yes, the other thing I also want to talk about is the financial status of these girls. Because of the pandemic, some parents have lost their jobs, and these girls are forced to go out there to sell. They are even exposing themselves to harsh environmental conditions. They are exposing themselves to even the COVID-19 itself. So the COVID-19 has really done a lot of harm to us. Most of our girls are on the streets selling. Most of them are doing head cutting, which in Ghana here we call it kayayo, in order to fend for themselves. And so as part of the recommendations, I also want to say that we want to compel AU to ensure all its member states to ensure that every girl is gone back to school post-COVID-19. Currently in Ghana, our president is the champion for gender. So we want him to set the example for other African countries to follow. We want the government to put policies in place such that no girl child is left behind. AU should compel all its member states to ensure that every girl is in school post-COVID-19. And then again, I also, as part of the recommendation, I also want to say that community engagement. We should, as much as we can, NGOs and other agencies should engage communities so to elaborate on how we can make these girls safe in the community. Community safety comes from the home and then the community as well. So even if the child is not safe at home, how much more the community? So we should make as much as we can. We should ensure that we engage community in our policies and our activities. And then the government should also provide safety tools and safety kits to these girls, especially sanitary pad. It breaks my heart when children, especially girls, are exchanging sex for sanitary pads. That is so heartbreaking. If there is any way the government could provide sanitary pads for these girls, I think it will go a long way to minimize cases of rape, cases of domestic violence, and any other form of violence we record daily. And we also want to recommend that the government, already in Ghana, the government has cushioned a stimulus package to ensure that women who are in entrepreneur or women who are in small-scale business doing something for themselves. I think as a result of the pandemic, it's not effective as it used to be. Now, post-COVID-19, we want to beseech the government to make these packages available so girls who for some way or the other has gotten themselves pregnant and they are at home can get something to better themselves. It is skills the person wants to learn. The government can do something for these girls as well. I believe that school is not the only solution to get there. If there is a way the government can provide this stimulus package to boost them to do something for their life, we'll be also very grateful. And moving forward, I also want to talk that since the inception of COVID-19, this is the time that every agency that has to do with humanity has to be on its toes to do its work. But in Ghana, our welfare system is very weak. Our welfare system, even though they are doing our best, but I think that in this serious time, it's time they step up their game a bit. So when we record issues of rape, issues of domestic violence, these children have where to seek for information. These girls know where to go for safety. So if AU or if any other body that is responsible can ensure that our welfare system in this COVID-19 era will be strengthened, we'll be very grateful. And then again, also want to talk about gender responsiveness. We want in these times, children are at home, and mostly, especially girls, they find the school as the only place for safety. They find the school as the only place where they can have their peace of mind, because at home they are exposed to every responsibility that has to do with house chores in the home. This COVID-19, as a result of them being at home, these girls are really, really, really going through a lot because they don't even have time to take their books and learn. In a typical African setting, they are made to do all the house chores. So as part of gender responsiveness, if we can engage the community, sensitize, do more of the sensitization so that parents will get to understand the education of the girl child also matters. So if they could share responsibility equally among their colleagues or their male siblings, so they could also have time to learn, they could also have time to have some form of recreational facility. And then again, we also want to talk about sustainable businesses. The COVID-19 is leaving a long-lasting effect on our economy, on our education, and everything that has to do with humanity. So if we are looking for solutions, we have to look for solutions that would go a long way to have a long-lasting effect on us. So if there is any way the government would provide sustainable businesses so that these women who has lost their jobs, these girls who has gotten themselves pregnant can find something to do. So it doesn't necessarily mean the person should go to school, complete university before getting a white-collar job to do. And then the government should also make sure safety kits or safety tools are available in especially the communities. So if I am raped and I go to the clinic, I am able to get I'm able to get space, or I'm able to get materials that would provide the first aid for me before even I'm taken to the hospital. These are all the things we lack in our clinics, and we'll be very grateful if these things are taken into consideration. To end my submission, I also want to say that if there is a way, sanitary pad is an issue, people or the somehow people don't take it seriously, but it's really an issue. Personally, I have an experience. Growing up, I grew up with my grandmother. I didn't know anything about menstruation because I wasn't brought up in an environment where these things are discussed openly. The first day I had my menstruation, this is the first time I'm sharing this. The first time I had my menstruation, I had to use the paper because I was scared to tell my grandma. And then again, my grandmother did not even have the money to afford a sanitary pad for me. So it was really an issue. I have to stay home. Way back at JHS, I have to stay home when I'm menstruating. So lack of information, lack of awareness, lack of these tools are really causing harm to the girl child. And it's a very sensitive issue. We tend not to take it seriously, but sanitary pad should be free for the girl child. If it should be free, it should be free. If the government wants to provide, the government should, because it's a necessity. I don't know why I should have sex just because I want a sanitary pad, something that is not my problem or something that is not my cause. So going forward, I think I've spoken enough, and I want to also say that the government should encourage vocational training. The government should encourage vocational training. In Ghana, currently, we are doing well with vocational training institutions, but I think that we also have to step up our game in providing skills for these young girls, basic skills that could, if it is beads making, if it is basketry, if it is wig making, anything that can get the girl child being equipped so that she doesn't lazy about exposing herself to environmental harm. So thank you so much. I'm done with my submission. And if there any other thing you want me to talk about, I'm ready for it, please.
Wow. Thank you so much, Hannah. I say that for your voice, for sharing your lived experience, and also through your voice for letting us know, what matters to you and to millions of girls and young women in Africa. You've mentioned a number of critical areas, the spike in domestic violence, transactional sex, the challenge around closure of schools, sanitary pad related challenges, and also harsh environment, financial challenges, and the need for sustainability. You've really covered, a very vast ground. Distinguished participants, everyone, Hannah has spoken, and I believe we've listened, and we've listened well. Now, let me move to Dr. Joanne Nyanyuki, the Executive Director of African Child Policy Forum. Dr. Joanne, you've served as a general physician in your early career and also led Amnesty International in East Africa, the Horn, and Great Lakes region. Now, I really want you to please reflect on the vulnerabilities and also risks for girls in Africa in relation to COVID-19 and, relating it with your experience. Kindly stick to the 6 minutes we have. Dr. Joanne, the floor is yours.
Thank you very much, Sarah, for that introduction. Good afternoon, good morning, Your Excellency El Fadil, Your Excellency Catherine Mwangi. Thank you, Ms. Hannah, and good afternoon to all ladies and gentlemen. It's really my privilege to share with you and to pick up from Hannah on what she discussed on the vulnerabilities of girls. And to help you follow me in my conversation, I will share my slide. Sarah, you will confirm that you can see my slide. I'm just trying to share it.
Yes.
That's not what I intend to share. Just a minute. This is what I want to share.
Yes, it's here.
All right, so let's continue. So without being very repetitive, the focus of this conversation is really to highlight the intersection of factors that have left African girls at greater risk of marginalization and discrimination by virtue of their age and gender. Control and mitigation measures targeted at minimizing COVID-19 infections have unfortunately exacerbated an already dire web of vulnerabilities and risks for girls in Africa. And we've already seen the pandemic has triggered major concerns globally and especially in Africa on the reversal of gains achieved over the years towards gender equality
child survival, and on a broader level, human development. This is already the reality for millions of girls deprived even before COVID-19 of access to food, basic healthcare, protection, and the thousands more exposed to abuse and exploitation. And so I will focus my presentation on the key vulnerabilities we have identified in 4 broad areas. And I'll start with gender-based violence and exploitation. Because of the quarantines and stay-at-home measures which we have all experienced, and as we have heard from Hannah, girls have become more vulnerable and constantly and closely at risk of abuse and violence. We have seen in Uganda, Kenya, Tunisia, South Africa, increased incidences of widespread gender-based violence. In Niger, there's been an escalation of forced child marriages. In Zimbabwe, what Hannah has just mentioned has been happening. Girls forced into transactional sex simply to survive. And in Ethiopia, where the African Child Policy Forum is based, we have seen reports of increased cases of sexual violence and rape, some perpetrated by family members. In fact, in just 2 months, in the period of April and May, there were more than 100 cases of rape reported. In the second element, where we see girls being more vulnerable and at risk, is in terms of poverty and hunger. Her Excellency Ambassador Catherine Mwangi has already referred to the ILO projections of increasing numbers of poverty, increasing numbers of loss of earnings. And we have seen that the impact of school disruption on girls, who often depend on the school meal as the only decent meal in a day, has left more than 26 million girls now missing out on their school meals. In fact, we are seeing in Egypt on its own, 5.2 million girls missing school meals and 4.5 million in South Africa. When it comes to access to basic health services, since the onset of COVID-19, measles immunization campaigns have been suspended in at least 27 countries, which we documented together with our partners, Plan International, in this study. And we have seen that polio campaigns have been disrupted in 38 countries. Cumulatively, this is exposing 80 million children under 1 year of age in the first year of life to permanent and irreversible medical complications, which may arise should they get infected by measles or polio. In Uganda, due to the lockdown, girls' access to medical facilities has been reduced by at least 35% within this short period. Access to education, I don't know how to believe at this, because really we are saying this has had the hugest impact of girls, and more than 120 million girls have been affected by the school closures in different ways. I will not repeat what Ms. Hannah has gone through, but just to highlight that girls are likely to drop out of school more than boys to look for jobs to sustain families. And this is where we see sexual exploitation of children happening, transactional sex going on, child labor happening. And we have confirmed anecdotal reports of this. And the pandemic and its broad effects in the long term may adversely and irreversibly impact on girls' enrollment in schools and their long-term educational attainment. Coming to child marriage and FGM, the economic difficulties combined with loss of the protection offered by the school environment have compounded the problem of early forced and child marriages in the region. In the northern part of Ethiopia, a month into COVID-19 crisis, which was in April, there were reports of 766 planned child marriages, which were fortunately averted by the local authorities. In Kenya, there have been reported cases of forced child marriages, again driven by the economic hardships. We have also seen girls being forced into marriage for the purposes of economic gain for families struggling with loss of earnings. FGM, which is a huge burden to African girls, we have seen 2 very alarming reports. First, in Kenya, where the number of girls facing the cut has already increased, simply because the community and child protection and governance systems have become dysfunctional and are operating at minimum levels. Globally, almost in the 90%, is witnessing at this time a huge increase in FGM, as girls have more time to heal physically, as school that is not opening soon. But I must pause here to remind you that in FGM, when girls heal physically, the psychological and the social trauma lives with them for a lifetime. So our concerns in terms of risks go beyond the physical healing. Two more categories. In terms of access to sexual and reproductive health services, which are essential for adolescent girls, there has been a disruption in access to these services. We have seen an interruption of supply chains and commodities for sexual and reproductive health services. This include family planning, response to rape, emergency response care for rape, and other forms of sexual violence. Reassignment of medical staff from family planning and other sexual and reproductive health services, because these are deemed non-essential, and staff being assigned to COVID care responses. In Uganda alone, in one district, in a period of 2 months at the beginning of this crisis, 40 primary school girls were reported to have become pregnant. We have seen similar numbers or more worrying numbers in South Africa and in Kenya. School closures mean that girls are more likely to be forced to engage in sexual activity now more than before, and hence are more likely to get pregnant. And we all understand what the impact of pregnancy is on children who are school going and what it means, or what early childbirth means. Girls in vulnerable situations, these are girls who are living with disabilities, domestic workers, girls living on the street in urban slums, girls in institutional care for different reasons, either because they have no guardians or because they are on the move. Girls in detention centers, refugees and other girls on the move, including stateless girls, have been more severely affected because their responses have not been inclusive and have not captured them. And therefore, this has left millions of girls in vulnerable situations without access to protection, to services, and at greater risk of physical and sexual abuse. In my next slide, I will move forward to really just referring to what the Ambassador Catherine Mwangi has already spoken to in terms of what needs to be done. And I will not repeat or belabor this because I believe my colleague Sam will touch on that, and I will leave the rest open for our discussion. Thank you very much. Back to you, Sarah.
Thank you so much, Dr. Joan, for providing us with a very articulate message and also data around vulnerabilities and risks for girls in Africa. I've talked about a number of issues, including gender-based violence and exploitation, poverty and hunger, access to education, child marriage and FGM, access to SRHR, and then also special needs, specific needs that needs to be covered around girls in vulnerable situation. And it's also striking to see that a lot of these damages may not be reversible, particularly those on social and psychological aspects. Thank you so much, Dr. Joan. Now, I'll move to Mr. Samuel Norga, Director of Plan International, African Union Liaison Office. Mr. Samuel, you have ample experience in various capacities, both with government, private sector, and also civil society and international NGOs, with vast experience working with children and youth in addressing issues including poverty, inequality, gender-based violence, and also youth employment in so many countries, particularly in Africa. So Samuel, what are the key actions that you think are needed from the African Union, member states, and civil societies, particularly in mitigating the impact of COVID-19 on girls in Africa? And kindly stick to the 6 minutes allotted time, please.
Thank you very much, Sarah. And I want to pay special tribute to all girls who have been affected in any way by COVID-19. I think if you read through the report, it's staggering, it's frightening, it's concerning, and sometimes very disturbing. And taking on from where Hannah started, and especially on issues of of sanitary pads and menstrual hygiene management. I mean, I wasn't going to talk about that as part of what I was going to talk about, but because I also come from Ghana and because our president is supposed to, or not supposed to, our president is the gender champion for the African Union, I want to use this platform to reiterate that the 20% tax on sanitary pads in Ghana should be scrapped. I mean, it's one of the reasons that Hannah talked about, and I think it's high time that we hold the government accountable. I'm not sure if our president, my president, is listening to me, but I'm very sure there are people listening in. Those who are tweeting, please tweet again, and please tell our president that the 20% tax on sanitary pads kindly should be scrapped, because that is one of the reasons why girls don't recognize the presence of community. Fadil, and also Ambassador, and also my fellow discussants. I think there's recognition that the fight against the impact of COVID on girls cannot be won by a single approach and cannot be won by a single entity. And as a result of that, every effort and resources needs to be properly coordinated to ensure that the sustainability of our response on the impact of COVID should assume a multidimensional approach across all levels, and with deliberate focus on gender implications and the multiplier effect of the intersectionality between age and sex, something that we often overlook. I mean, I think it has been said, and I think Commissioner Elfadel made reference to that the African Union, member states, and other stakeholders, including our frontline workers, have been at the forefront of fighting the pandemic. But the reality is that COVID has exposed the unpreparedness and the weak state of our fiscal and social infrastructure to absorb the impact of any large-scale pandemic. And sadly, education, health, social protection mechanisms and systems have crumbled under COVID. And the reality is that the impact of COVID have shaped and changed the normal way of protecting the rights of girls and the provision of services. And heard that from some of the earlier discussants. But again, access to education, health services, information, survival have all changed and require concerted and deliberate and innovative ways to guarantee the right of girls, and particularly that of those in very vulnerable circumstances. And so I think I would want to also say that any approach and response to COVID should be long-term. I mean, the impact is going to be seen and it's going to linger on for a long time. So we should make sure that any response to COVID is not short-term, but also creates a platform for ensuring equity and equality. And so specifically to the African Union, some recommendations. I would like to appreciate the role of the AU in taking steps in appointing special envoys on COVID. The setting up of the COVID fund is all appreciated. And the role of the Africa CDC in coordinating the African response to COVID is also appreciated. But in terms of what we would want them to continue to do, we would want them to continue to coordinate and intensify effort at all levels in the fight against the pandemic through political and organizational leverage to mobilize resources, both internally within the continent, but also externally for the fight against COVID. They need to provide extra support to government in post-conflict and fragile situations. We have countries, most countries in Africa, which provide technical support to member states, especially as they implement the African Committee of Experts on the Rights and work for the chart guiding notes on COVID-19, which again, Commissioner Elfadel mentioned. To member states, we want them to adopt a right-based and gender-responsive and sensitive approach to COVID, especially in applying human rights approaches based on the principle of the best interest of the child, ensuring that messages and information packages around COVID are formulated in a way that promotes gender equity and equality, but also ensuring that measures relating to social distancing, quarantines, partial, full lockdowns are friendly to girls and cognizant of the needs and capacity and vulnerability of girls, and some also relate to some of the issues mentioned by Hannah. We also want our government and civil society organizations to recognize the voice and agency of girls. They need to be involved, they need to be taken into account when formulating COVID responses. And we also need to build their capacity and agency and not just look at girls as beneficiaries, but look at them as able to contribute to the discussions and formulation of policies around COVID. Moving on, we'd want poverty alleviation and economic support to extend to girls in a way that ensures that access to urgent life-saving provisions, services, healthcare, etc., sanitation are made available to them, but also scaling up economic safety nets, poverty alleviation programs, cash transfers, making sure that mothers who are the breadwinners of girls and children in most cases have economic packages that support and cushion them against the impact of COVID. Now, gender-based violence have been on the increase. I think everybody have mentioned it. It's a reality. The girls themselves have said it. Hannah put it in very clear terms. And so in terms of responding to gender-based violence, we would want government and civil society organizations working in collaboration to reinforce multi-sectoral child protection mechanism for girls, especially those who are at risk of abuse and violence, exploitation, and also making sure that community-based child protection mechanisms are strengthened and also address online child abuse within our response plans. We also want to make sure that we are mitigating the exploitation of girls, especially addressing issues of FGM, child marriage, and other gender-based violence, and bringing perpetrators to book, and they have to be brought to book rapidly. Moving on, we want to ensure access to basic and sexual reproductive health and services. We need to prioritize adolescent sexual and reproductive health services through policy instruments and also through funding, and making sure we are creating safe spaces, non-stigmatization channel for girls who are in need of those services, and also ensuring that we have access to and providing access to modern contraception, menstrual health management, and other sexual reproductive health services, which currently is not possible because of lockdowns and restriction in movements. Education is a big area. I mean, we all are here because we benefited one way or the other through the provision of education. And one of the areas which have suffered the most is education. And so we want to call on member states, we want to call on civil society organizations and donors to provide access to long distance and digitized learning. What we do realize, and you find that in the report, is the fact that even though we talk about access to education through digital platforms, the majority of girls don't have access to those platforms. And so they are losing out on education, and government need to provide the infrastructure and the services to be able to support that. But also something that is very dear to me is re-enrollment of girls who become pregnant. I think that has become very evident. That was mentioned by Joanne, that was mentioned by Hannah as well. We need to make sure that girls who unfortunately become pregnant because they are locked home, and we're not talking about just providing them access to school, we are talking about policies that ensure that they go back to school and they are reintegrated into education, which also means that we need to make sure we are providing for their children who have been born to them because of COVID. Education response plans will have to be gender and age responsive, and will have to reflect the lived realities of girls, especially those with disabilities, those in humanitarian settings, and those who have been marginalized through no fault of theirs. And finally, we want to recommend that any information coming out from our response and from our planning will have to be disaggregated by age, by location, and also making sure that the information is accessible to everyone and to the girls themselves. Now, finally, I would want, and I can see you're looking at your time, I would want to conclude by saying that we need to underscore the fact that girls are not objects and benefactors of COVID responses. In fact, any decision that affects them should have their input. And secondly, any action that impacts on their life should recognize their lived realities and ensure that no one is left behind. I know we are talking about silencing the gun. I mean, For me, the biggest gun we see now is COVID, and so any impact, any unfortunate situation that forces girls into a situation of vulnerability need to be addressed. And like I said in the beginning, I would want to reiterate, our president, please make sure that we take out the 20% tax on country pass and ensure that all girls have access to that. Thank you very much, Sarah. Back to you.
Thank you so much, Mr. Samuel, for those powerful and also clear call for action. And I think the 20% tax on sanitary pads in Ghana also applies to many other member states in Africa. And I think that's really well noted. Also, thank you very much for emphasizing on girls and young women, in conflict and post-conflict situations, and talking about the right-based approach, the best interest of the child, and also making sure that gender equality is at the cornerstone of all the plans and strategies, but also emphasizing the gender digital divide when we talk about girls' education and education in general. Now, we'll come to our last speaker, Ms. Lydia Atomsa. She's the Senior Policy Officer for Gender and SRHR in the Embassy of the Kingdom of Netherlands in Ethiopia. Lydia, you're a lawyer by training and also worked at the Institute for Security Studies. In your current role as the Senior Policy Officer at the Embassy of the Kingdom of Netherlands, you facilitate and also promote integration of gender in all sectors under the development coordination. So my question to you is to actually give us an insight on the role of development partners in improving resilience and also curbing the unprecedented impact of COVID-19 on girls in Africa, and also supporting the CSOs that are also, really in a difficult situation to operate. So you respectfully have 6 minutes, so I appreciate if you also stick to the time. Thank you.
Thank you, Sarah, for the introduction. Let me first extend my appreciation to Plan and SCPF for the great work that you're doing in advancing children's rights agenda in Africa. I also would like to join the speakers before me in commending the timely report, which is really extensively assessing the vulnerabilities of girls through this very difficult time that we are in. Well, as you said, as development partners, definitely we have a great role to play, not just necessarily as as financiers, but also as shaping policies and dialogues in different areas. So particularly in times of pandemic, it's very important that development partners continue supporting development efforts and even step up the effort for development. I'm not undermining the importance of humanitarian needs currently, but really the emphasis has to be even more like we need to really continue the effort towards development and transforming societies. And it's very clear also from the report that COVID really indeed has exposed already existing weaknesses in systems, and it exposed the gender gaps and persisting inequalities. So we really need to ask ourselves, what should we do differently? What should we do? What should we intensify and refocus? And also in building resilient systems and societies, and so that our societies are able to handle shocks such as this pandemic. As development partners, I would say we need to really advocate for gender transformative approach. This has been already mentioned by previous speakers. Really, we need to address root causes of poverty, inequality, in all efforts that we're doing to transform the socioeconomic status of countries and societies. So what do I mean by this? So we need to really be seriously committed in having gender transformative policies and development initiatives. It also definitely calls for a long-term engagement. This is really transforming. I mean, as we are really clearly seeing the deficiencies in our systems, the commitment has to be also long-term, and the support has to be long-term in order to sustain the change. That's also very important. And also it requires us to really focus also on system building. Without resilient systems and institutions, it's very hard also to cope and handle big crises like this. So our effort also has to be not only in supporting government systems, institutions, but also recognizing and also strengthening civil society organizations in their contribution towards building resilient societies and holding governments accountable to their commitments and international, human rights obligations. So the Dutch, just to give an example of how we're contributing in support of addressing the impact of the crisis within our already existing programs. As you know, probably for us, advancement of gender equality and improving the position of women and girls is very much at the center of what we do in Ethiopia in all the development cooperation sectors. In all the work we do, we really try to actively give attention to these issues. But also in this very difficult time, we've supported our partners in establishing the temporary shelter to admitting new cases or new survivors of SGBV. Not only that, we've continued to support our partners who are engaged in sexual reproductive health and rights services, so that it's not interrupted, but as well incorporates COVID responses within the limits of the program and the reach. So being flexible also in terms of our approach and allowing partners to really be able to incorporate responses within already existing programs for addressing the prevention, the protection, and also the provision of services connected to to the COVID. So this is just to give an example that there are already within the existing efforts, there's still a lot of room to accommodate. But what we would like to emphasize is that we really have to focus on the long-term development efforts so that we have resilient systems. So that's really the focus that we would like to see also in the coming years. Over to you, Sarah.
Thank you so much, Lydia. It's really reassuring to hear the commitment, readiness, but also available plans and also strategies to support efforts in curbing the impact of COVID-19 on girls, as well as supporting civil society engagement in those. You've also emphasized the role of development partners in shaping policy. advocating for gender transformative approaches and policies, and also, long-term engagement with governments and also civil society actors, strengthening and building weak systems. So I think that's really reassuring to hear that. Thank you again. Now, I'd like to open the floor for reflection and questions from our distinguished participants. We've been joined by more than 220 participants. So just a few procedures to note are first, kindly raise your hands, and then when you're allowed to speak, you kindly introduce your name, the institution you represent, and the country. And please try to make your intervention as brief as possible so that, we can accommodate, more distinguished participants to take the floor. Please also feel free to use the chat box for the Q&A. So I look into participants who raise their hands.
There are a couple of questions in the Q&A. I'll probably...
Kindly, yes. Yeah. If you kindly read that, yes, please.
Let me just pick a few. We can start with those ones and then we can do a lot. I think there's one to one. Did the study also reach out to girls in refugee settings to capture their voices and challenges within this COVID-19 period? This is from Emily. I think it's directed to Dr. Joanne. And there's the one, most of the panelists said that girls are more protected at school than at home. Is this the case in rural settings or urban settings?